AV Fistula for dialysis. Introduction. During hemodialysis, a special filter removes the waste and extra fluids from the blood. Select true or false. Correct. During hemodialysis, your blood is allowed to slowly flow through a special filter that removes waste and extra fluids. The clean blood is then returned to your body. Why is the AV fistula considered the best long-term vascular access? Choose one of the following options. 1. It causes the vein to grow larger and stronger. 2. It makes it easier to access your blood for hemodialysis. 3. It lasts a long time and has a low complication rate. 4. All of the above. Correct. The AV fistula is considered the best long-term vascular access for hemodialysis. It provides enough blood flow, lasts a long time, and has a lower complication rate than other types of access. An AV fistula can be created when an artery is joined to a vein or an artificial graft is used to connect the vein to the artery. Select true or false. Correct. In the basic procedure, the surgeon joins an artery to a vein, but for some patients, an artificial graft may be used to create the fistula. Is a heart attack the most common complication of an AV fistula? Select yes or no. Correct. The most common but still not very likely complications of an AV fistula are infection of the vascular access and low blood flow due to blood clotting. Without proper care, your AV fistula may be less effective for hemodialysis treatments. Select true or false. Correct. Proper care can make hemodialysis more effective. It can also help prevent complications. Thank you for using Explain.